Question 1. A post-op patient is drowsy and pale with a blood pressure of 90/58 mm of mercury and heart rate of 110 bpm. What is the nurse's priority action? A. Elevate the head of bed. B. Encourage oral fluids. C. Notify the provider. D. Assist to ambulate. Answer. C. Notify the provider. Rationale. These are signs of potential hypovolemic shock. Immediate provider notification is essential to initiate treatment and prevent deterioration. Question 2. A diabetic client becomes confused and diaphoretic during shift change. What is the nurse's first action? A. Offer orange juice. B. Call the provider. C. Check blood glucose. D. Administer insulin. Answer. C. Check blood glucose. Rationale. Confusion and diaphoresis are signs of hypoglycemia. Verifying blood glucose is a priority before administering treatment. Question 3. A nurse finds a post-op patient's abdominal dressing saturated with blood. What should the nurse do first? A. Remove the dressing and apply gauze. B. Measure the drainage and document it. C. Reinforce the dressing and notify the provider. D. Lower the head of the bed. Answer. C. Reinforce the dressing and notify the provider. Rationale. Saturated dressings may indicate active bleeding. Reinforcing maintains pressure and sterility while awaiting provider intervention. Question 4. A nurse assigns a UAP to ambulate a client who is 1 day post-op. What action requires the nurse to intervene? A. The UAP places non-skid socks on the client. B. The UAP walks the client without using a gait belt. C. The UAP notifies the nurse the client felt dizzy. D. The UAP reviews the fall protocol before walking. Answer. B. The UAP walks the client without using a gait belt. Rationale. A gait belt is essential for client safety during ambulation. Not using one increases fall risk and requires nurse intervention. Question 5. A client receiving IV potassium reports burning at the IV site. What should the nurse do first? A. Stop the infusion. B. Increase the rate. C. Slow the infusion rate. D. Flush with saline. Answer. C. Slow the infusion rate. Rationale. Potassium is an irritant to veins. Slowing the rate reduces discomfort while maintaining therapy. Stopping may interrupt treatment unnecessarily. Question 6. A client with COPD has oxygen saturation of 88% on 2 liter per min via nasal cannula. What should the nurse do first? A. Increase O2 to 4 liter per min. B. Raise the head of the bed. C. Administer a bronchodilator. D. Notify the provider. Answer. B. Raise the head of the bed. Rationale. Positioning improves ventilation before escalating oxygen, which could suppress respiratory drive in COPD patients. Question 7. A patient who is 24 hours post-appendectomy complains of severe abdominal pain and a rigid abdomen. What is the priority action? A. Give prescribed pain medication. B. Ambulate the patient. C. Notify the healthcare provider. D. Apply a warm compress. Answer. C. Notify the healthcare provider. Rationale. A rigid abdomen and pain post-op may indicate peritonitis or internal bleeding, which require immediate intervention. Question 8. A client with diabetes is NPO for surgery. What is the nurse's priority regarding the scheduled morning insulin dose? A. Give full dose as prescribed. B. Hold the insulin. C. Clarify with the provider. D. Give half the dose. Answer. C. Clarify with the provider. Rationale. NPO status alters insulin needs. The nurse must clarify to avoid hypoglycemia. Question 9. During a blood transfusion, the patient develops chills and back pain. What is the nurse's first action? A. Notify the healthcare provider. B. Slow the infusion rate. C. Stop the transfusion immediately. D. Administer acetaminophen. Answer: C. Stop the transfusion immediately. Rationale: chills and back pain indicate a transfusion reaction. The transfusion must be stopped immediately to prevent further complications. Question 10. A nurse hears wheezing in a post-surgical client. What should the nurse do first? A. Administer an albuterol inhaler. B. Notify the provider. C. Elevate the head of bed. D. Assess oxygen saturation. Answer: D. Assess oxygen saturation. Rationale: assessment is the first step in clinical judgment. Oxygen saturation provides objective data to guide next actions. Question 11. A client with a central line reports chest pain and shortness of breath after flushing. What is the priority action? A. Administer morphine. B. Obtain a chest X-ray. C. Place the client in left lateral Trendelenburg position. D. Document the findings. Answer: C. Place the client in left lateral Trendelenburg position. Rationale: these are signs of air embolism. Positioning prevents air from traveling to cerebral circulation while awaiting emergency treatment. Question 12. A nurse enters the room and finds the client seizing. What is the nurse's immediate priority? A. Start IV access. B. Place an oral airway. C. Turn the client to the side. D. Restrain the client's arms. Answer: C. Turn the client to the side. Rationale: turning the client prevents aspiration and supports airway protection during a seizure. Question 13. A patient with heart failure gains 3 pounds in 24 hours. What is the nurse's next best action? A. Restrict fluid to 1 liter per day. B. Notify the healthcare provider. C. Increase diuretic dose. D. Reweigh the patient after 1 hour. Answer: B. Notify the healthcare provider. Rationale: rapid weight gain signals fluid retention and worsening heart failure. Provider must be informed for treatment changes. Question 14. A nurse receives an order to give potassium IV push. What is the appropriate response? A. Administer slowly over 5 minutes. B. Dilute in 10 milliliters saline and push over 2 minutes. C. Question the order immediately. D. Administer via central line only. Answer: C. Question the order immediately. Rationale: potassium IV push is contraindicated due to risk of fatal arrhythmias. The nurse must challenge unsafe orders. Question 15. A client recovering from thyroidectomy reports tingling around the mouth. What is the nurse's priority intervention? A. Offer oral calcium supplement. B. Reassure the client it's normal. C. Assess for Chvostek sign. D. Notify the provider immediately. Answer: D. Notify the provider immediately. Rationale: tingling post-thyroidectomy may indicate hypocalcemia from parathyroid injury, which can lead to laryngospasm. Question 16. A client receiving morphine via PCA is difficult to arouse with shallow respirations. What is the nurse's first action? A. Call the rapid response team. B. Administer naloxone. C. Stop the PCA pump. D. Increase oxygen flow. Answer: C. Stop the PCA pump. Rationale: the first step is to stop the source of sedation. Then naloxone and further support can be initiated. Question 17. A client develops red, itchy hives after receiving IV antibiotics. What is the priority nursing action? A. Notify the provider. B. Administer diphenhydramine. C. Stop the IV infusion. D. Flush the IV line. Answer: C. Stop the IV infusion. Rationale: signs of allergic reaction require stopping the causative agent immediately to prevent progression to anaphylaxis. Question 18. A nurse is caring for a client with confusion who keeps trying to remove their IV. What is the nurse's best action? A. Apply wrist restraints. B. Reorient the client frequently. C. Request sedation. D. Apply mitts without an order. Answer: B. Reorient the client frequently. Rationale: least restrictive interventions like reorientation should be attempted before restraints or sedation. Question 19. A patient on warfarin reports bleeding gums and dark stools. What is the most appropriate nursing action? A. Teach to avoid green leafy vegetables. B. Instruct to hold the next dose. C. Notify the provider immediately. D. Document and monitor closely. Answer: C. Notify the provider immediately. Rationale: these are signs of over-anticoagulation. Provider needs to evaluate INR and adjust therapy. Question 20. A nurse prepares to administer a new IV antibiotic, and the client says, "I had hives the last time I took this." What is the priority action? A. Administer slowly with monitoring. B. Give a test dose. C. Notify the provider and hold the dose. D. Give diphenhydramine premedication. Answer: C. Notify the provider and hold the dose. Rationale: previous allergic reaction is a contraindication. The nurse must protect the patient from a repeat exposure. Question 21. A nurse hears a high-pitched sound from a tracheostomy client during inhalation. What is the best next action? A. Document the finding. B. Increase oxygen flow. C. Suction the tracheostomy. D. Notify the provider immediately. Answer: C. Suction the tracheostomy. Rationale: high-pitched sounds indicate airway obstruction. Suctioning relieves secretions and prevents respiratory distress. Question 22. A patient on telemetry shows peak T waves. What lab value is most important to check? A. Magnesium. B. Sodium. C. Potassium. D. Calcium. Answer: C. Potassium. Rationale: peak T waves are a hallmark of hyperkalemia, which can cause life-threatening arrhythmias. Question 23. A client receiving chemotherapy has a temperature of 100.9 degrees Fahrenheit. What is the nurse's priority action? A. Recheck in 1 hour. B. Administer acetaminophen. C. Notify the provider. D. Encourage oral fluids. Answer: C. Notify the provider. Rationale: even mild fever in immunocompromised patients may indicate serious infection. Immediate evaluation is warranted. Question 24. A nurse is teaching a client with heart failure about daily weight monitoring. What instruction is most critical? A. Weigh weekly and report weight gain. B. Weigh every morning after breakfast. C. Weigh at the same time daily with the same clothes. D. Weigh only when you feel swollen. Answer: C. Weigh at the same time daily with the same clothes. Rationale: consistency allows for accurate trend monitoring, especially for fluid retention. Question 25. A patient is prescribed digoxin. Which assessment must the nurse perform before administration? A. Measure blood pressure. B. Check potassium levels. C. Count apical pulse for 1 full minute. D. Monitor oxygen saturation. Answer: C. Count apical pulse for 1 full minute. Rationale: digoxin can cause bradycardia. Pulse must be assessed prior to administration to prevent cardiac complications. Question 26. A nurse enters the room and sees the client's chest tube drainage system knocked over. What is the priority action? A. Clamp the chest tube. B. Reconnect the tubing. C. Assess the client's respiratory status. D. Call the provider immediately. Answer: C. Assess the client's respiratory status. Rationale: The first step is always patient assessment to identify compromise before intervening or calling the provider. Question 27. A client receiving vancomycin develops flushing and itching during infusion. What is the nurse's priority? A. Stop the infusion and notify the provider. B. Slow the infusion rate. C. Administer diphenhydramine. D. Check for airway swelling. Answer: B. Slow the infusion rate. Rationale: Red man syndrome is caused by rapid vancomycin infusion and can be managed by slowing the rate. Question 28. A nurse prepares to administer a medication that looks different than usual. What is the best action? A. Verify the medication with another nurse. B. Administer the medication as ordered. C. Hold the dose until the pharmacy confirms. D. Ask the client if this looks familiar. Answer: C. Hold the dose until the pharmacy confirms. Rationale: Patient safety requires verification of any discrepancies before administration. Question 29. A postoperative client has absent bowel sounds and a distended abdomen. What is the next best action? A. Document as expected after surgery. B. Notify the healthcare provider. C. Encourage early ambulation. D. Administer pain medication. Answer: B. Notify the healthcare provider. Rationale: Absent bowel sounds and distension may signal paralytic ileus and require prompt provider evaluation. Question 30. A nurse notes a new onset of confusion in an elderly patient with a urinary catheter. What is the priority nursing action? A. Check the latest lab results. B. Assess for signs of urinary tract infection. C. Notify the healthcare provider. D. Ask family about baseline mental status. Answer: B. Assess for signs of urinary tract infection. Rationale: Confusion in older adults is often the first sign of infection, especially UTI. Question 31. A client with a history of falls is found on the floor. What is the nurse's first action? A. Move the client to the bed. B. Check for injuries. C. Notify the provider. D. Document the incident. Answer: B. Check for injuries. Rationale: Patient safety requires immediate assessment for injury before taking further actions. Question 32. A nurse finds a patient with oxygen saturation of 84% while sleeping. What should the nurse do first? A. Wake the patient and reassess. B. Increase oxygen flow. C. Administer a bronchodilator. D. Call rapid response. Answer: A. Wake the patient and reassess. Rationale: Low oxygen saturation may be falsely low due to sleep or probe misplacement. Reassess first. Question 33. A client is on contact precautions. What action by the nurse ensures infection control? A. Wearing a mask when entering. B. Placing the client in a private room. C. Using alcohol-based sanitizer only. D. Disposing sharps in a red bag. Answer: B. Placing the client in a private room. Rationale: Contact precautions require isolation to prevent the spread of organisms. Question 34. A nurse delegates vital signs for a client receiving blood to an unlicensed assistive personnel UAP. What instruction is essential? A. Report any temperature above 100.4 degrees Fahrenheit. B. Take the blood pressure on the left arm. C. Document values in the chart only. D. Recheck vitals every 4 hours. Answer: A. Report any temperature above 100.4 degrees Fahrenheit. Rationale: Fever may indicate transfusion reaction and must be reported immediately. Question 35. A client post-myocardial infarction is anxious and restless. What is the priority nursing action? A. Administer anti-anxiety medication. B. Notify the provider. C. Assess oxygen saturation and chest pain. D. Encourage deep breathing. Answer. C. Assess oxygen saturation and chest pain. Rationale. Restlessness may signal hypoxia or ischemia. Further assessment is needed. Question 36. A patient with a tracheostomy is coughing and secretions are audible. What is the next best action? A. Increase the oxygen flow. B. Perform tracheostomy suctioning. C. Notify the provider. D. Encourage fluids. Answer. B. Perform tracheostomy suctioning. Rationale. Audible secretions and coughing indicate the need for suctioning to maintain airway patency. Question 37. A patient with liver cirrhosis has a new prescription for lactulose. What is the nurse's priority? A. Monitor for constipation. B. Assess for signs of hepatic encephalopathy. C. Check serum potassium levels. D. Teach that it lowers blood pressure. Answer. B. Assess for signs of hepatic encephalopathy. Rationale. Lactulose is used to reduce ammonia and treat encephalopathy. Monitor mental status closely. Question 38. A diabetic client reports shaking and confusion. What is the nurse's first action? A. Check blood glucose level. B. Give 50% dextrose, IV. C. Notify the provider. D. Give orange juice. Answer. A. Check blood glucose level. Rationale. Blood sugar must be verified before intervention to avoid inappropriate treatment. Question 39. A nurse finds a medication error occurred in the previous shift. What is the priority action? A. Complete an incident report. B. Notify the charge nurse. C. Assess the patient for harm. D. Document the error in the medical record. Answer. C. Assess the patient for harm. Rationale. Patient safety is the first priority after discovering a medication error. Question 40. A patient suddenly becomes confused and has slurred speech. What is the nurse's priority? A. Perform a full neurological assessment. B. Administer aspirin. C. Notify the stroke team. D. Place in high Fowler's position. Answer. C. Notify the stroke team. Rationale. Sudden neurological symptoms suggest stroke. Rapid response ensures time-sensitive treatment. Question 41. A client with a feeding tube starts coughing during feeding. What is the immediate nursing action? A. Check residual volume. B. Stop the feeding. C. Elevate the head of the bed. D. Suction the oropharynx. Answer. B. Stop the feeding. Rationale. Coughing during feeding indicates possible aspiration. The feeding must be stopped immediately. Question 42. A nurse witnesses a colleague taking narcotics from the med cart. What is the appropriate action? A. Confront the nurse directly. B. Report to the charge nurse. C. Document the incident in the chart. D. Ignore if the patient is not harmed. Answer. B. Report to the charge nurse. Rationale. Drug diversion is a serious violation that must be reported through the chain of command. Question 43. A client on IV heparin has a platelet count drop from 250,000 to 90,000. What is the priority action? A. Check PT/INR. B. Discontinue the IV line. C. Notify the provider immediately. D. Lower the heparin dose. Answer. C. Notify the provider immediately. Rationale. Sudden platelet drop suggests heparin-induced thrombocytopenia, which requires stopping the medication. Question 44. A nurse assesses a client 1 hour after cardiac catheterization via femoral access. Which finding is most concerning? A. Bruising at insertion site. B. Mild groin discomfort. C. Pulse is absent in the affected leg. D. Blood pressure of 138/88 mmHg. Answer. C. Pulses absent in the affected leg. Rationale: absent pulses suggest arterial occlusion, a serious complication requiring immediate action. Question 45. A patient is prescribed a medication labeled for another client. What should the nurse do? A. Hold the dose and call the pharmacy. B. Administer since the prescription matches. C. Cross out the wrong name and give it. D. Return the medication to the med room. Answer: A. Hold the dose and call the pharmacy. Rationale: giving a mislabeled medication can be dangerous. It must be verified and relabeled appropriately. Question 46. A client with a history of seizures reports auras. What is the nurse's priority? A. Document the occurrence. B. Administer prescribed antiepileptics. C. Ensure seizure precautions are in place. D. Notify the healthcare provider. Answer: C. Ensure seizure precautions are in place. Rationale: auras may precede seizures. Safety measures must be in place to prevent injury. Question 47. A nurse is caring for a client with suspected meningitis. What is the priority action? A. Initiate seizure precautions. B. Administer IV antibiotics. C. Place the client in droplet precautions. D. Elevate the head of the bed. Answer: C. Place the client in droplet precautions. Rationale: meningitis is contagious and droplet precautions must be started immediately. Question 48. A nurse notes the IV site is red and tender with a palpable cord. What is the next best action? A. Flush the site. B. Apply warm compress. C. Discontinue the IV line. D. Administer anti-inflammatory medication. Answer: C. Discontinue the IV line. Rationale: these are signs of phlebitis. The IV must be discontinued to prevent further injury. Question 49. A client with asthma develops wheezing after taking propranolol. What is the priority action? A. Administer albuterol. B. Notify the provider. C. Check the blood pressure. D. Elevate the head of the bed. Answer: A. Administer albuterol. Rationale: beta blockers can trigger bronchospasm in asthma. Albuterol relieves the airway constriction. Question 50. A patient has just returned from a bronchoscopy. What is the priority nursing assessment? A. Vital signs every 15 minutes. B. Monitor for blood and sputum. C. Assess for return of gag reflex. D. Measure oxygen saturation. Answer: C. Assess for return of gag reflex. Rationale: the gag reflex must return before giving food or fluids to prevent aspiration. Question 51. A nurse is caring for a client with pneumonia who becomes restless and confused. What is the priority action? A. Reassure the client. B. Assess oxygen saturation. C. Increase IV fluids. D. Notify the provider. Answer: B. Assess oxygen saturation. Rationale: restlessness and confusion may indicate hypoxia. Checking oxygen saturation helps guide immediate intervention. Question 52. A client receiving IV morphine reports dizziness and becomes difficult to arouse. What should the nurse do first? A. Administer naloxone. B. Increase fluid rate. C. Call the provider. D. Document the findings. Answer: A. Administer naloxone. Rationale: these are signs of opioid overdose. Naloxone reverses respiratory depression caused by morphine. Question 53. A diabetic client becomes diaphoretic and confused. What is the nurse's immediate action? A. Check urine ketones. B. Notify the provider. C. Give 4-ounce orange juice. D. Administer insulin. Answer: C. Give 4-ounce orange juice. Rationale: these are signs of hypoglycemia, and quick glucose replacement is the priority. Question 54. Which task is appropriate for the nurse to delegate to a certified nursing assistant? A. Perform wound dressing change. B. Measure and record urine output. C. Provide discharge teaching. D. Assess for pain. Answer: B. Measure and record urine output. Rationale: this is within the CNA scope. Other tasks require nursing judgment or skill. Question 55. A post-op client suddenly reports chest pain and dyspnea. What is the priority action? A. Notify the surgeon. B. Administer morphine. C. Apply oxygen via mask. D. Reassure the client. Answer: C. Apply oxygen via mask. Rationale: sudden chest pain and dyspnea may indicate a PE. Oxygen supports tissue perfusion, while further interventions are arranged. Question 56. A client receiving potassium IV reports burning at the site. What should the nurse do first? A. Stop the infusion immediately. B. Apply a warm compress. C. Dilute the infusion. D. Slow the rate and assess the site. Answer: D. Slow the rate and assess the site. Rationale: potassium is irritating to veins. Assess before stopping. Slowing the rate helps reduce discomfort. Question 57. A client with cirrhosis is confused and has a hand-flapping tremor. What is the nurse's priority? A. Start seizure precautions. B. Monitor ammonia levels. C. Hold opioids. D. Initiate fall precautions. Answer: B. Monitor ammonia levels. Rationale: confusion and hysterexis are signs of hepatic encephalopathy, often caused by high ammonia levels. Question 58. A client with a chest tube suddenly develops subcutaneous emphysema. What is the priority action? A. Clamp the tube. B. Notify the provider. C. Reposition the client. D. Reinforce the dressing. Answer: B. Notify the provider. Rationale: subcutaneous emphysema can indicate air leak or lung injury and requires provider evaluation. Question 59. A client with atrial fibrillation is on warfarin. The INR returns as 4.5. What is the priority action? A. Continue the dose. B. Withhold the dose and notify the provider. C. Administer vitamin K. D. Encourage fluid intake. Answer: B. Withhold the dose and notify the provider. Rationale: INR greater than 4 indicates increased bleeding risk. Withhold the drug and contact provider before taking further steps. Question 60. A nurse is preparing to administer insulin glargine and regular insulin together. What is the correct approach? A. Mix both insulins in one syringe. B. Administer separately using 2 syringes. C. Hold regular insulin. D. Give glargine before meals. Answer: B. Administer separately using 2 syringes. Rationale: glargine should not be mixed with other insulins due to risk of altered pharmacokinetics. Question 61. A client with a nasogastric tube has 400 milliliters green drainage in 2 hours. What is the nurse's best action? A. Clamp the tube. B. Irrigate the tube with water. C. Document the output. D. Lower the suction pressure. Answer: C. Document the output. Rationale: this is expected gastric drainage. No action needed unless there are signs of abnormality. Question 62. A nurse is caring for a post-op patient with decreased urine output. What is the priority assessment? A. Palpate for bladder distension. B. Review last serum creatinine. C. Assess skin turgor. D. Check IV site. Answer: A. Palpate for bladder distension. Rationale: urinary retention is common post-op. Bladder assessment guides further action like straight cath. Question 63. A client newly prescribed lithium reports nausea and fine tremors. What is the priority nursing action? A. Hold the medication. B. Increase salt intake. C. Assess lithium level. D. Encourage hydration. Answer. C. Assess lithium level. Rationale. Nausea and fine tremors may indicate early toxicity. A level check is needed before adjusting the dose. Question 64. A client receiving vancomycin develops flushing and itching of the face and neck. What should the nurse do? A. Stop the infusion. B. Administer diphenhydramine. C. Slow the infusion rate. D. Notify infection control. Answer. C. Slow the infusion rate. Rationale. These are signs of red man syndrome. Slowing the rate reduces histamine release. Question 65. A client with COPD on oxygen becomes drowsy and difficult to arouse. What is the priority? A. Stop the oxygen. B. Increase oxygen flow. C. Decrease oxygen flow. D. Turn the client on their side. Answer. C. Decrease oxygen flow. Rationale. High oxygen in COPD clients can suppress respiratory drive. Reducing the flow may restore alertness. Question 66. A client with Addison's disease is found unconscious and hypotensive. What is the first intervention? A. Begin CPR. B. Administer hydrocortisone (IVC). Give 4-glucose. D. Start oxygen. Answer. B. Administer hydrocortisone IV. Rationale. Addisonian crisis is treated with steroids urgently to restore fluid and cortisol balance. Question 67. A client with a PEG tube is due for medications. What should the nurse do first? A. Crush all pills and flush together. B. Verify placement and residual. C. Hold all enteric-coated meds. D. Elevate the head of bed. Answer. B. Verify placement and residual. Rationale. Tube position and residual volume must be checked to ensure safe administration. Question 68. A nurse hears crackles in a client receiving IV fluids at 200 milliliters per hour. What is the best action? A. Stop the fluids. B. Slow the infusion rate. C. Call respiratory therapy. D. Give loop diuretic. Answer. B. Slow the infusion rate. Rationale. Crackles suggest fluid overload. Slow the rate to prevent worsening symptoms. Question 69. A client post-thyroidectomy reports tingling around the mouth and fingers. What is the priority assessment? A. Check blood glucose. B. Assess calcium level. C. Check potassium level. D. Monitor thyroid levels. Answer. B. Assess calcium level. Rationale. Tingling indicates hypocalcemia, a complication of parathyroid injury during thyroid surgery. Question 70. A nurse finds a client with a tracheostomy, coughing, and producing thick secretions. What should the nurse do first? A. Apply humidified oxygen. B. Suction the tracheostomy. C. Increase oral fluids. D. Notify the provider. Answer. B. Suction the tracheostomy. Rationale. Suctioning clears the airway, improving oxygenation and reducing aspiration risk. Question 71. A client on clozapine reports fever and sore throat. What is the nurse's next action? A. Administer acetaminophen. B. Hold clozapine and notify the provider. C. Encourage oral hygiene. D. Give lozenges. Answer. B. Hold clozapine and notify the provider. Rationale. Fever and sore throat may indicate a granulocytosis, a serious side effect. Medication must be stopped. Question 72. A nurse finds that a client's urinary catheter has no output for 4 hours. What is the priority action? A. Flush the catheter. B. Assess for kinks or obstruction. C. Reinsert a new catheter. D. Increase fluid intake. Answer. B. Assess for kinks or obstruction. Rationale. Mechanical issues must be ruled out first before taking further action. Question 73. A nurse gives IV potassium to a client and the patient complains of burning. What should the nurse do? A. Stop the infusion. B. Notify the provider. C. Dilute further and slow the rate. D. Apply ice pack to the site. Answer. C. Dilute further and slow the rate. Rationale. Potassium irritates veins. Slowing rate and dilution help reduce discomfort. Question 74. A post-surgical patient is confused and trying to pull out the IV. What should the nurse do first? A. Apply wrist restraints. B. Stay with the client and redirect. C. Call security. D. Turn off alarms. Answer. B. Stay with the client and redirect. Rationale. Non-restrictive measures are first-line interventions for confused patients. Question 75. A nurse notices that a client's wound has eviscerated. What is the immediate action? A. Reinsert the organs. B. Cover with sterile saline dressing. C. Apply dry gauze. D. Call the surgeon after documentation. Answer. B. Cover with sterile saline dressing. Rationale. Moist sterile dressing protects exposed organs and prevents infection before surgical intervention. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.